So I'm Ajinkya. I'm practicing pediatric ophthalmologist and strabismologist, and with special interest in community ophthalmology and research. So coming to the question of my topic, I would answer in one word first. Yes, it is a very good career choice and a very promising one. Why? Let's see. So children are 1/3 of our population and all of our future. And so is the magnitude of this problem. Even in India, there are more than 410 million children who are less than 16 years of age, and the prevalence of childhood blindness is 5 times as that of it's seen in developed world. Overall, 60 to 70% of the childhood blindness is either avoidable or treatable, and rest 30% requires low vision and rehabilitation care. So you understand what is the magnitude of a pediatric eye care problem in our country. As per WHO, one children's eye care center is required for every 10 million population, where at least one specialty trained or specialty oriented ophthalmologist should be available. And now this warrants immediate doubling of the number of dedicated children's eye care units across India. So this is the first point, the magnitude of problem and the requirement. There is a huge gap. Now, what is our patient base? So we deal with this huge patient base, right from the preterm newborn to the newborn, infant, toddler, preschool children, school going children, and adolescent. All these different age group patients present with varied spectrum of eye related problems. Additional to this, we also deal with adult squint patients. So we have a huge patient base and a lot to work and lot to do in this field of pediatric ophthalmology and strabismus. Now, monopoly is the condition of every successful business. So how do we have the monopoly? Many comprehensive care providers do not feel comfortable managing pediatric patients. And we manage various ocular issues, right? From the eyelid to the anterior segment to the optic nerve to the posterior segment. I would go even behind to the cortex in cases of cortical visual impairment or cerebral visual impairment. And we manage these patients with rare and complex disorder, and we get to work as a team with other pediatric subspecialties. And we are a hot commodity. There are very low numbers of pediatric ophthalmologists, and this allows us for ability to find work in an otherwise saturated job market. I'm not sure about the increased power of negotiation though, but yes, few say it is true. The most important thing which we usually talk these days and people are getting aware not only in medical field but otherwise also, so this work life balance is very important. So how do we have it? How do we achieve it? So being in pediatric ophthalmology, there are relatively low after hours and on-call responsibilities compared to the emergent retinal detachments and entrapped orbital flow fractures. There are relatively few amblyopia and strabismus related emergencies. So we pediatric ophthalmologists, we enjoy a good work-life balance. Now, strong relationships. Many pediatric ophthalmology issues such as amblyopia, strabismus, glaucoma, ptosis, ROP, these all problems, they have long lasting impact on the eyes and the visual system, and it requires continued follow up. So if you are someone who likes to build the relationships with your patients and watch them grow and improve, mind you, this field is for you. Again, there is a lot to do in public health and international work. One can find funding opportunities for community outreach program, both locally and abroad, where there is significant need for pediatric ophthalmology care providers. Now, what is QALY? We have all learned in the preventive and social medicine. It is quality adjusted life years. So the vision that you save in a child in childhood will serve your patients their whole lives. So you operate one adult cataract and you gain 20 years of vision on an average. You operate one infantile cataract, you gain 80 years of vision. Again, if you treat an amblyopia, you see the amblyopia being treated, the vision getting better with each visit. This dramatic improvement in vision will assure you that these patients will get to keep this vision for their adult lives. And mind you, the satisfaction that gives you by preventing or gaining these light years in these terms is really very satisfying. And taking care of children is fun. You get to play the games, use toys, you stay young at heart. I remember most of my YouTube playlist now consists of Five Little Monkeys jumping on the bed or Baba Black Sheep, and I really enjoy it. And kids in OPD, when you see them, at least in each OPD, you will have that one cute kid which will enlighten your day, and you will be free from all the tensions and relief and all the worries which you are facing throughout the day. And they will do the funniest things, and you will always have these stories to tell and share with your friends and colleagues. So I'll leave you with this thought that the idea is to die young as late as possible, and being in the field of pediatric ophthalmology will ensure you to get closer to this idea. Thank you so much for the opportunity.